Tay Sachs disease is a rare inherited disorder that progressively destroys nerve cells in the brain and spinal cord. Tay Sachs disease is a fatal genetic lipid disorder, an autosomal recessive gene found on chromosomes. May be detected by 6 months of age. If both parents are carriers, there will be 25% chance that the child will have Tay Sachs, 50% chance that the child will be a carrier, and 75% chance that they'll have a normal child. Tay Sachs disease, or TSD, is a fatal genetic disorder that results in destruction of the nervous system over time. It begins most often in children. TSD is caused by lack of an important enzyme in the body. Without the enzyme, a fatty substance known as lipid collects in certain cells of the body. On the right, there's a normal brain cell and a brain cell that has Tay Sachs. Tay Sachs disease is very rare in general population. Tay Sachs is an autosomal recessive disease caused by mutation in both alleles of the gene HexA on chromosome 15. HexA enzyme is found in liposomes, organelles that break down large molecules for recycling by the cell. This condition is inherited in the autosomal recessive pattern, which means both copies of the gene in each cell have mutations. The parents of the individual with the autosomal recessive condition each carry a copy of the mutated gene, but they typically do not show signs and symptoms of the condition. Again, it is an autosomal recessive genetic disorder. This means 2 Tay Sachs alleles are required to have it from both parents, one allele being a carrier, showing abnormal enzyme activity. Tay Sachs disease phenotype, a genetic disorder in which the individual does not have a special protein to break down fat in the brain. Without the protein, fat builds up, causing loss of mental and motor skills, like blindness. They can't crawl, can't walk, they can't eat by themselves. They often get pneumonia. Mutation in the gene is located on chromosome 15. A person needs 2 recessive alleles to show the disorder, and there is no cure or effective treatment. Patients don't normally live past 5 years of age. And this is the stuff I went over already.